Most people think diabetes starts when the body can't make insulin anymore. But with type 2 diabetes, insulin is often still there. So the real question is, why does blood sugar rise anyway? That answer turns out to be more interesting and more gradual than most people expect. In this video, we'll walk through what type 2 diabetes actually is, what's happening inside the body, step by step, why it often develops quietly over time, and why many people are surprised when they're told they have it. This is an educational overview, not medical advice, meant to help you understand how doctors usually explain this condition. Type 2 diabetes is a condition where sugar builds up in the bloodstream because the body is no longer handling it efficiently. Sugar, also called glucose, is the body's main fuel source. It comes from many of the foods we eat and needs to move from the blood into cells, where it can be used for energy. Insulin is the hormone that makes that transfer possible. In type 2 diabetes, that system becomes less effective, not suddenly, but gradually. This reduced response doesn't happen overnight. Doctors believe it's influenced by several long-term factors working together, such as how cells handle repeated sugar exposure over time, changes in how muscles and liver cells process fuel, the way fat tissue communicates with the rest of the body, and age-related shifts in metabolism. None of this is about a single food, a single habit, or a sudden failure. It's more like wear and tear on a system that's been compensating for years. As insulin becomes less effective, sugar lingers longer in the bloodstream. The pancreas works harder to release more insulin, and over time, insulin production may no longer keep pace. At that point, blood sugar levels tend to rise more consistently, and that's when type 2 diabetes is usually recognized. Importantly, this entire process can unfold quietly, without obvious warning signs. Many people are surprised by a type 2 diabetes diagnosis because the condition develops slowly, the body compensates for a long time, and early changes often don't cause pain or dramatic symptoms. That's why type 2 diabetes is commonly discovered during routine lab work rather than after a sudden event. In population studies, millions of adults are estimated to have type 2 diabetes, and many don't realize it until a healthcare visit brought it to light. It helps to briefly clarify what type 2 diabetes is not. Type 1 diabetes involves an immune-related loss of insulin production. Type 2 diabetes, by contrast, usually begins with insulin resistance, often includes insulin being present, especially early on, and develops gradually rather than suddenly. That difference matters for understanding how doctors think about the condition. In healthcare settings, type 2 diabetes is usually discussed as a long-term metabolic condition, not a short-term problem. That's because it's connected to how the body manages energy over many years, not just what happened last week or last month. This long view helps explain why conversations around type 2 diabetes tend to focus on patterns, trends, and overall health, rather than a single moment in time. If there's one idea to remember, it's this. Type 2 diabetes usually isn't about insulin disappearing. It's about insulin not working as efficiently as it once did, after years of gradual change. Understanding that mechanism can make the condition feel less mysterious and less sudden when people hear the diagnosis. If you found this explanation helpful and want more clear, calm breakdowns of how common health conditions work, consider subscribing. New videos are added regularly.